Hello, I'm Andrea Darup, a professor of pathology at Duke University School of Medicine, where I am the course director for our medical school pathology course. I am also a co-editor of Robbins' Essential Pathology and of the upcoming edition of Robbins and Kumar Basic Pathology. Now this talk, 2 Quick Fixes to Improve Equity in Medical Curricula, is part of the Pathology Central Race in Medicine series. And even though I say 2 quick fixes, this will not be a short video because I do have to provide some context. I typically introduce this sort of material at about the 40-minute point of a talk on race in medicine, where we've already discussed how biological race is often conflated with socially defined race, and about why biological race is not an appropriate metric or something to consider in medicine. So I've talked now for about 30 to 40 minutes, and my audience is thinking, oh, please tell us what to do. We see now that there's a problem. How do we fix it? And so this is just to provide some 2 quick fixes that you can bring in right away into your medical school curriculum. Now, I don't know who you are watching this. I don't know if you're a medical student who's thinking we need to have some changes in how we deal with race, and I don't know how to go about affecting change, and this video looks like it will help. Or maybe you're a medical educator and your thinking is the students are asking for this, or the administration is putting pressure on me, or I have recognized myself that there are deep problems in how we present race in our curriculum. What do I do? So this will help you out. And as a bonus, you don't actually need to believe that any of this is important. So if you're watching this and you think, I don't think there's a problem as far as equity in medical curricula, I think it's okay. Even if you don't believe this, you can still use these 2 quick fixes and it will move things in the right direction. Now, my other point is, these are just quick fixes. This is not dealing with the underlying problem of structural racism in medicine. And I encourage you to not stop at this point, right? To go ahead and do this. See how you feel, what things come up for you, what works with your students. And I will address this in a larger lecture talking about teaching for equity. I personally have done a year-long Teaching for Equity fellowship at Duke, which was an incredible experience where we did a deep dive and a lot of soul-searching and inquiry into how to teach equitably. And that is the basis for these 2 quick fixes. And I encourage you to continue on your journey towards becoming someone who really teaches equitably to all of your students and residents. So here they are. All right, so remove material regarding race from vignettes, so either the cases that you use to teach from or in your multiple choice questions, and provide inclusive images. Simple, easy peasy, right? So removing material regarding race from vignettes was challenging for me when I first started looking at this. So I began as a course director at Duke in 2015. And all the first-year course directors met with Dr. Kenny Raley, who is the director of our Cultural Determinants of Health Disparities longitudinal course at Duke. And he said, you really need to look at how you use race in your vignettes. And I was astonished because I really believed in 2016 that biological race had some impact on health and medicine, and that it was very important for my students to know that, for example, Ewing sarcoma is very uncommon in patients of African descent. I thought that was really important. And now, 6 years later, I understand why it is not important. But you don't need to understand why, right? I'm just going to say, remove material regarding race from your vignettes. Now, the reason that I included race and ethnicity in so many of my vignettes was that I thought it gave an increased appearance of verisimilitude, right? Also, I was frequently using case reports because, I might not know a good clinical presentation of diabetes. I'm a pathologist. So I do a case report, I'd find a vignette, and if they had a 42-year-old Hispanic female, that was what I had. I had a 42-year-old Hispanic female, right? It seemed more real somehow. And that's actually one of the reasons why there is a push to keep race in vignettes. And I will mention, just as a sidebar, one of the reasons that I say this is a quick fix and you don't need to understand it, but here is some of the reasons why some people do think we should retain race in vignettes. And that is because if you do not include race, the assumption, the person that your students, your residents, your faculty will envision is doubtless someone of European descent, because that is such the dominant culture here, that if something says a 40-year-old man, I'm immediately thinking of someone with blonde hair, blue eyes. Right? So that is one argument for keeping race in your vignettes, but that's more sophisticated. Right now we're doing just remove it, okay? And I will tell you that when I did this, when I talked with Dr. Raley, my lower lip came out because I thought my vignettes were good, they were based on the literature, and it was going to help my students. And I really felt strongly that my students needed to know, for example, that Ewing sarcoma was very uncommon in patients of African descent, because say, for example, 10 years from now, one of you sends out a biopsy from a 15-year-old male who's of African descent, and the pathology reads it out as a Ewing sarcoma. I want you to think, but wait a second, I remember Dayrup told me it's very uncommon in patients of African descent. Go take another look, be sure, do the molecular. But there's a reason why that whole view is false. And some of that is described in the Race and Robbins video. Some of it, if you mention in the comments, and I get enough requests for it, I'll go ahead and do a video on that as well. So I just went ahead with my lower lip sticking out, and I removed race and ethnicity from all of my vignettes, right? And what I have discovered since then is that it was the right thing to do. It was such the right thing to do, and there was no question about it. Now, I do want to make one comment, and this is referring back to my earlier video on Race and Robbins. Keep in mind, we're talking here about using race as a biological variable, which it is not. Okay, race is socially constructed. So race is appropriate in vignettes where you are talking about social determinants of health, right? But it can never be just, this patient is African American, I'm going to make these assumptions about socioeconomic status, education, access to care, whatever, right? You can use socially defined race in the context of addressing socially defined race, not in the context of disease. Okay, I know this is complicated. So just trust me, just remove your material regarding race from vignettes. And then I'll talk about providing inclusive images. Okay, so here's an example. This was a question that we were going to include in Robbins' Essential Pathology as part of the 600 plus multiple choice questions that you have access to if you use this book. And this was provided to me. It's a classic case. It's a 54-year-old Native American woman with, and I will tell you, because we work so hard on these word associations, right? As soon as you see the word Native American woman, you will think, well, gallstones, right? It's gallstones. It can't be severe combined immunodeficiency, which is the other thing that we think about. Could be diabetes. These are the three things you think about when you see someone who's a Native American, because that is what the curriculum is pushing. That's what you'll see in UWorld. That's what you'll see in your test prep, all these sorts of things. So I said to the author who gave this to me, I'm like, we really need to remove this about Native American, right? And he responded by saying, yes, but it's very common in Native Americans. And I said, but the whole point is we want our students to work through this vignette. And if you just teach them catchphrases and buzzwords, high yield facts, they're not going to be great clinicians. They may do great on that particular UWorld question or on that NBME step question, but do you want to miss an ectopic pregnancy or acute appendicitis in a woman, okay, admittedly 54, a little bit old for an ectopic pregnancy, but stay with me on this one. Do you want to risk missing that because you've taught someone this word association? Furthermore, we've put together this great vignette. I mean, look at this. We've got right upper quadrant pain for a week, no vomiting or diarrhea, okay, marked tenderness, liver's normal. Oh, we see that she's got an increased BMI. We have calculi within the lumen of the gallbladder. It appears thickened, right? So this is telling us that this patient has gallstones, right? But if you just have a 54-year-old Native American woman, then the student doesn't get a chance to work through this, right? they never get to work through all the abdominal ultrasound or looking at the image like, oh, it's gallstones, and so it's going to have to be biliary hypersecretion of cholesterol. Next question, right? So we want to do this for our students, and we want to do this so that we do not perpetuate racial stereotypes or racial heuristics. Okay, so that's that one. Now, inclusive images. So as I mentioned, 5 years ago, I went through and I removed all race and ethnicity from all of our vignettes. And at Duke, we teach using a website that has multiple cases with virtual microscopy and clinical images and gross images and radiology. And so I removed all of the race and ethnicity. And so you can see here, now you don't need to, have someone say that this is a 62-year-old European American man, right? You can look at the skin and you can say, okay. So we went ahead and just, removed that. But this year, what I learned, because I'm always learning, is that this isn't enough, right? We need to show what lesions look like in different skin types. So not just light skin types, but dark skin types and in between, because things look different. So for example, what we do now is for every image that we show on our website, we have a corresponding image in a different skin type. And I want you to know we're also doing this in the next edition of Robbins and Kumar Basic Pathology, so that your students will have the opportunity to look, or you as a student will have the opportunity to look and compare and contrast, because it's not, it doesn't look the same. Frequently what we describe as erythematous in light skin types is hyperpigmented in dark skin types. And so if you're looking for a classic reddish lesion and instead you see something that has a darker appearance to it, you might think, oh, that's not what it is because it's supposed to be erythematous. So here's what we do now at Duke. This is an example. This is a basal cell carcinoma. And you can see here why this is so important, right? Because to the uninitiated, this looks a lot like it could almost be a melanoma, right? But this is a basal cell carcinoma in a dark skin type. So it's important for students and future physicians, for all of us, to know what the different appearances are. Now, we've worked on this in the Robbins textbook. So for example, there's a classic description of basal cell carcinoma as a pearly papule. Well, it really doesn't look pearly in dark skin types. So we want to be very careful with our language when we are teaching as well. And it's just, the argument is frequently made that, well, but it shows up so much better in light skin types. Well, yes, it does. The targetoid rash of erythema migrans for Lyme disease sure does look a lot clearer on light skin. But then we're not teaching people to recognize it when a patient comes in with dark skin, and that's a topic of another video. So, use inclusive images. Now, you may be saying, well, where do I find these, right? Because it is so ingrained in our in medical education or in medicine in general that it can be hard to find images of lesions in dark skin types. So I'm providing for you a list of resources, and I will put them in the comment below so you can just click through on them. Mind the Gap is the one that's at blackandbrownskin.co.uk. I really like, if you're looking for images, the Skin of Color Society has a list of dermatology textbooks, and there are a lot that include skin of color. And this is really nice. You can go ahead and get them from the library, use as images. And what you will see on this in coming years is that Robbins and Kumar Basic Pathology will be here, because as I mentioned, we are using and providing images in different skin types so that our students, your students, all of you will have access to those. So this is this was just I guess a reasonably short talk of two things to do. Now, it may be a little controversial, right? Feel free to shoot me an email, but I want you to have something to do as you go through the process. And I promise you I will put together a video as well on how to do the work and what teaching for equity looks like. But for right now, the quick fix, something that you can do that will address your curriculum, if you address these two things, it's a great first step. So thank you very much. Please subscribe, check out the website, send me an email, comments below. I'm here to help. Thank you and have a great day.